Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Zoe Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's episode where we're talking about the power of the breath. The power of the breath is so essential for posture, function, and healing. It's really the foundation of life, and we're chatting about this because recently I've had, some experiences with Ellie May, where she just has struggled with her breathing for a really long time, and she's had a few injuries to her abdominals and potentially even to her diaphragm, and how it really has an influence on her behavior, her posture, and the connections that are flowing through her body. So, how are you going today, Soph?
Going very well. Yeah, this is a good topic because there's so many examples. There's so many, and we have some interesting examples to share too about when breathing or their anatomical connections within the system of breathing have been very pivotal for a horse's health.
Yeah, it's really essential for the whole body, I observe it a lot. I've spent a lot of time just observing how horses breathe and feeling how they breathe, and observing dogs as well when I treated a lot of dogs because they'd be sleeping in the sessions, and so I'd often just sit there and observe the changes in their breathing throughout the session, which was really interesting. And so it's another area that we can draw our observation skills to and just bring us a wider awareness of our horses and the connections that are happening within their body. So first of all, we're just going to talk about what is regular breathing?
So for horses, they have a relatively, this is so funny. I remember being shocked when I first learnt this because I thought, how could you possibly survive on 8 to 15 breaths a minute? So it's quite a slow breathing rate.
So,
If you think 8 breaths a minute, that's one every sort of 7.5 seconds, thereabouts in a minute. It's not very many. And of course it's quite a lot higher in foals, and then it kind of peters out as they get older to be pretty neutral by about 18 months old. It can also be a bit higher in ponies as well. And breathing is considered one of the vitals. So it's something that you check by watching the rib cage. Often you can kind of stand by the horse's shoulder and you look back and you can see their flank swell and go back in. And so it's a really strong health indicator. It's very important. It's something that your vet will check when they come out, to have a look at an injury or something like that. And it's a very important system. So it is the respiratory system, and it's there, as a foundation, like we said, for 8 to 15 breaths a minute, but you can get all the way up to 120 to 150 breaths per minute at peak demand, which is a crazy amount of oxygen to be pushing in and out. So a horse, one breath, like just taking in and out, brings in 5 liters of air. And when you increase that demand, so when you're actually exercising, it takes in more air, so 12 to 15 liters per breath, which is, when you think about volume, that's a lot of volume to bring in. And then if you times that by 120 to 150 breaths per minute, you are bringing in, sucking in, and then having to push out a huge amount of air. And so the anatomical structures are under a huge amount of demand, realistically.
Yeah, I mean, that's what makes horses one of the facets that makes horses such amazing athletes, is their ability to utilize a lot of air to gain the oxygen that fuels the muscles, that fuels the energy production within the muscles and the removal of waste products, and Um, yeah, and especially when they're doing disciplines that are very fast, like racing and eventing, you want that system to be working as optimally as it can be. One interesting fact, I know you've got a fun fact to share, but one fun fact that I'd like to share is that we cannot train the respiratory system of the horse. So we can't make them have more air that they take in or more breaths that they take in. Like we can train their recovery heart rate. We can't change a horse's maximal heart rate, but we can train them to have an improved recovery. And we can, influence their muscle fiber types, which is going to influence energy usage. We can influence like optimal function of respiratory structures, such as we're going to talk about those in a minute, like respiratory muscles and the diaphragm, and we can influence those, but we can't like train it as such, if that makes sense. So, um, yeah, but horses have such an amazing athletic capacity. They're just really, that's why they can do so many different sports as well. What's
Definitely.
your fun fact?
So my fun fact is the reason that we want horses to spend the majority, like 80% of the time that they're eating. Obviously, we love browsing, so that's an important thing to point out. But
Yeah.
there's quite a lot of time that the horse needs to have their head down while they're grazing and eating, and that is because they have one very long tube going from the nose all the way down to the lungs, and so it's called the mucociliary escalator. There's a system inside the trachea and coming down to the lungs where basically the lining of that tube is covered in these little hairs called cilia, and they um, kind of coated in like a mucus that's being produced by the surface of that tube. And what happens is, as the horse breathes in, and they're eating off the ground, they're picking up dust and all sorts of things as they are eating and breathing. All of that mucus and those little hairs catch all the dirt that's flying up the tube, and then they use that mucociliary escalator to drain everything back down. So that's when the horse puts its head up and does that snort that immediately gets snot all over the clothes you're in that you want to go out in, right as you're feeding them, as you walk out the gate. So that all that
And
stuff
just
has
next
been
time when that happens, you can be like, good mucociliary
a
escalator.
good mucociliary escalator. So that yeah, that's a very, very important system. And yeah, it's the primary reason why it's very important to make sure that your horse is spending enough time eating from the ground, especially, if you feed predominantly hay, then you need to be putting that hay on the ground, not lifted up.
Yeah, there needs also, especially when there's been times of stress or exposure to potential respiratory bugs. Like when a horse has been traveled, say we'll just use the racehorses for example, because their respiratory system cops it in lots of ways, and they're very prone to viruses. One way is just because of the work that they do. The next is the travel. Often horses travel in a float or a truck and they don't have a chance to put their head down. And then there's at the races in cross ties, and they may not, depending on the cross ties, how much they can put their head down there. Then they go out and race, and they're not generally not eating at the races, so they're not getting a chance to just put their head down and eat. And so, and they've got stress just from environmental stresses. So they're really prone to viruses for lots of reasons. But yeah, one thing that would probably help them a lot is like if they could have some time when they arrive at a venue, and this goes for any horse that's been traveled on a float or a truck, arrive at the venue, let them have some head down time. Whether you put hay on the ground or they go eat some grass, and make sure they have that throughout the day just to kind of keep any stuff that's building up in there shifting out, and improve their respiratory health, especially if they've been kept in stables overnight and they might have been fed up. It is important for respiratory health. The other thing is horses don't cough as easily as we do when they get sick. You were talking about foals that you've seen with rattles, which is a lung infection, and how, yeah, you hear them rattling, like in the space
Yeah.
called rattles. But um, yeah,
They
they
don't
don't
all cough.
often
Yeah.
cough, and but by the time the horse is coughing, there's a significant reason for them to be coughing. Whereas we cough on a regular, basis. Like we can cough just we're
Clear our
healthy.
throat. There's
Yeah, like
nothing.
we're healthy. We've got a bit of like stuff in our throat, and we just cough. Horses don't just really cough as a normal part of their daily life. So
Yeah.
that's
And
why mucociliary clearance is really important.
yeah, anyone who's seen a horse cough, and they do that like it sounds like like it's such a wheezing big effort. They really spit stuff everywhere and have a big like it's a honk.
Yeah, and usually there's a reason for that, like they've got something stuck or they're really unwell. So
So
we're going to talk about the anatomy now of the breathing. What are some important muscles that are utilized in
so
that?
you've got your intercostal muscles. So your intercostal muscles go from one rib to the next, and you've got your internal and external intercostals, and they basically pull the ribs together and sort of apart, like they're kind of on oblique angles. So they're used to draw oxygen in and push oxygen out, like for inspiration and expiration. You've also got your serratus muscles. So the serratus muscles, there are the serratus dorsalis, cranialis, and caudalis, and they're these kind of like sharp tooth triangular muscles at the top of the ribs, just below the rib shelf. And so they play the same role. We're going inspiration and expiration. There's also the abdominal muscles, which are very important, and we've talked about those a few times. They play a really big role in the motion of breathing, but also um, the health of the rib cage, like it holding its integrity in the middle of the horse. You also have your diaphragm itself. So the diaphragm is this dome-shaped muscle that's actually it's the only non-paired muscle in the horse. So every muscle in the horse has two of them. There is only one diaphragm, and it's basically it goes stretches across behind the lung and the heart organs, and it separates the abdominal and visceral cavity from that front space. And so the diaphragm is super, super important because its contraction and expansion is a really big part of the breathing motion. And so it's only about 1 to 1.5 centimeters thick, which, when you consider what we were just saying about the amount of pressure that that space is under when you're sucking in huge volumes of air at a time, that's, it's very muscular, and it has tendinous portions. So it's under a huge amount of work, and it's also never resting. Like there's no time that the diaphragm is ever just switching off and having a rest. So it's a constant motion. And so it attaches underneath the 16th thoracic vertebra. So not
Roundabout, yeah. Depending if they've
roundabout
got how many thoracic vertebrae they've got.
that they have. And so and then it sweeps all the way down to the back of the sternum, so on the bottom of the chest. So it's called the xiphoid, and it goes along the costochondral junction. So if you look at your horse's rib cage, you can see that there's kind of this scoop shape. So if you start from like T17, 18, thereabouts, and then you can see that the rib cage kind of scoops back towards the point of the hip, and then it comes back down towards underneath the horse's sternum, like towards the girth point. And so along that space, the ribs actually go from being kind of bony to having a cartilaginous portion, and that is called the costochondral junctions. Um, and yeah, so the diaphragm attaches on the inside along that line. And it's a very important muscle. It's skeletal muscle, and it's there mainly for inspiration as well.
Yeah, I think it's a really important point that it's skeletal muscle. Like, so the heart muscle is smooth muscle. Skeletal muscle is like the other muscles that we have in the body, like around the limbs and the power muscles that move things. And so they do require a fair amount of oxygen to work. It's mostly type 1 muscle fibers, which means that it utilizes oxygen. It can go for a long period of time when it's just at a resting period, but like they've shown in humans that it can fatigue, and I'm sure it happens in horses too, as they, are getting faster and faster as well. They have a lot of forces that act on that diaphragm in motion, the forward and back forces that are going through that diaphragm. I truly believe that it has a big influence on racehorses bleeding into their lungs. The relationship to that diaphragm, the tension in it, how well it can kind of absorb the pressures, and then what the pressures are between the lungs, the chest cavity and the abdominal cavity, and how that influences its function. Another way, when you're looking to where the diaphragm attaches, a simple way is to go from the point of hip or tubercoxy to the elbow and just draw a line along there. That line is generally the line of the diaphragm. It doesn't go as back as far as the tubercoxy. It goes obviously not as far back as even the last rib, but it gives you an indication of where that's sitting. And I have had some horses that when I've been treating them, there's a tension line. Like we see an abdominal tension line that's different. It's a bit lower down and it's more straight across. Whereas sometimes you can see the line of the diaphragm like pulling, and as practitioners, we can often feel its freedom or restriction along that area. And it's such an important structure because so many things pass through it. So we've got the esophagus, which is taking the food to the stomach. We've got the aorta, which is a big blood vessel taking blood from the heart to the body. We've got the caudal vena cava, which is bringing blood back from the body. We've got the vagus nerve, and the spine is passing through it at the top there as well. We also have the psoas muscles passing through at around the last couple of thoracic vertebrae. So psoas minor especially. And so the diaphragm, there's quite a connection to the psoas muscles with the diaphragm. The liver attaches to it um, up at the like the center of it. And so, all of those structures are going to be influenced when the horse is breathing. And so that we need to think about that diaphragm as it's a central structure for function of the horse. And if it's restricted, you can't get power generated from the hind end to flow through the body. You can't get good lift through the back. You'll get tension in the top line. You can't use the core properly if the diaphragm's restricted. It makes it, yeah, really difficult, as well as if any of those other muscles that we talked about have their own issues. So, what nerve is it innervated by?
The phrenic nerve, and the phrenic nerve originates from the cervical vertebrae 3 to 5. So it's coming a long way to exit, towards the neck and then travel back to innervate the diaphragm itself. So that phrenic nerve can be impacted itself. So there's something called thumps, which is basically where that phrenic nerve has been affected, and the heart rate and the diaphragm contraction. So the heart is pumping and the diaphragm is contracting at the same rate, so at the same time. And so often that happens with electrolyte imbalance. And it means like the phrenic nerve's been affected. And so there are different things that can affect that nerve. I know, you can have compression of it. It can be influenced. I've seen images in dissection where it's been adhered to other structures on its way to the diaphragm. So, it's important to know that, what's affecting, the nerve to the diaphragm can also be affected as well.
Yeah. And then the other part is just to recognize how much energy the diaphragm actually requires in maximal exercise. And this is why, I think that we can also get fatigue in horses. Like It uses 15 to 20% of the cardiac output, which is, the amount of blood that's being pumped by the heart. That's a lot, considering that we have a lot of we have a lot of big muscles in the rest of the musculoskeletal system that require that cardiac output, and how much the diaphragm itself requires it in continued exercise. So, yeah, we've got to think about it as a muscle to be trained as well. I've seen a number of horses with damaged diaphragms under dissection, like where the fibers have been disrupted, split. Um, and I also know of a horse that's had a diaphragm surgery from a rupture, and how much it has affected the way she can utilize her body. So again, just can't undervalue how important it is in whole body postural function.
Yeah, I also know a horse that had a torn diaphragm, but it wasn't discovered for a little while, and she acted like she'd lost her mind, and she lost a significant amount of weight, and she'd basically just had a significant loss in performance, like a reduction in performance. She was a racehorse, and she really did act like she'd lost her mind. She was running through fences and trying to very painful, and obviously that there's probably other structures affected, but what we were saying, breathing when you is a true form of relaxation when you can breathe well, and to have that system upset is very stressful for the whole body. You can't really enter a parasympathetic state if your breathing system and your diaphragm is influenced.
No, and I see that with Ellie, like I see sometimes her reactions outweigh, what's been happening. And I also can see areas of tension over her diaphragm attachments. And I wonder about the health of her diaphragm. I've had other practitioners now look at her who've, commented on her breathing and how difficult it is for her, how she's not kind of utilizing her whole rib cage in the breath, how the breath is not flowing, how there's a disconnect to her hind end. And yeah, I do wonder if whether she's just got adhesions in there, um, or whether, there's some other kind of damage to her diaphragm. And I guess time will tell to see how much it can improve. But it's certainly something that she's already been dealing with for a couple of years. So, probably from an injury that she had in the paddock, I think, because it's not one that I know happened. Like I've seen her injure herself a few times and I've seen her strain her abdominals, but I think that the first incident may have happened when I didn't see it. So horses breathe in a pattern called a biphasic breathing pattern, and what that means is that they have both an active and a passive component to both inspiration and expiration. So with us, we only have an active component that where we're using our muscles and using energy when we breathe in. And then when we breathe out, it's not requiring any energy. It just happens. But when we breathe in, there's energy required. With horses, there's energy required in both inspiration and expiration. So there's a passive component that comes back to what we call the functional residual capacity, but then there's an active component that breathes away from it in inspiration or expiration. Whereas for us, we breathe above that functional residual capacity. So we breathe above it and then our expiration goes back to it. We don't breathe around it like a horse does. So therefore, they require muscular effort to both breathe in and breathe out. And so that's requiring energy to support the function of the diaphragm. And yeah, if there's restrictions, you're going to see that the active portion is restricted. So they probably will have changes in inspiration and expiration. And then it depends what part of their respiratory system has been affected. But it's an important difference in horses to note. Um,
Oh, interesting too, when you see, I think that horses who have a restriction, as you're just talking about, it's hard to read their respiration sometimes. And I've been in that position, particularly years ago. I was really like, this doesn't look normal. That's actually, it's so funny. And taking going back to like first learning how to read the breathing motion, which is harder than like heart rate because you just put the stethoscope on, or you're just feeling a vein for the pulse. So you're watching, and it kind of feels like there's a two motion part. It kind of looks like you kind of like, did it go in? It looks like it's gone back out again. It looks jerky. And so yeah, because there's a muscular effort. So if you have your neutral, it's kind of like a balloon. As it inflates, you've got like a muscle effort away from that neutral. So they breathe in, and then it's just passive. It just automatically sucks back to the neutral. And then they've got like a little push, like an expiration, like to breathe out as much as they would to completion, and then it's just passive again, and the body automatically just inflates back to the neutral point, which you can feel in yourself. I was doing it even as you're explaining it. Like if you just think like I breathe in and then you just, oh, there's nothing. I just automatically breathe out. And it's almost funny when you stop thinking about it. And I think this is interesting. I've thought about this before. Breathing is we have a lot of influence over it because it's one of the things in our body where you can have a conscious influence and an autonomic influence. So things like your heart rate, you can't just be like slow down heart rate or fasten up like be faster heart rate to an extent.
yeah, there's some people
We
who can.
yeah, you can, or you can work yourself up intentionally. But we can influence it, be like, I want to bring myself down, I want to meditate or bring my heart rate down. But with breathing, it's just like I just change it. Like automatically, you can make yourself hyperventilate, you can make yourself breathe slow, but and you can also push out air when you want to. Like you can push extra air out, but the normal, it's like you can feel if I just breathe in and then it's hard to do when you start thinking about it. You're like, I have to breathe out. I have to breathe out. But it just happens automatically.
Yeah, and I think when horses become restricted in their breathing, they stay in the passive
Yeah.
place a fair bit. So they very shallow, it's very difficult to see their breathing. And you don't kind of see that active component of it. So you want to learn how you can observe your horse's breathing because it can bring you a lot of information, like not just from a health perspective, but from a function and a posture perspective. Because the more the body becomes involved in breathing, like the more complete the breath is through the entire body, the better function um, that the horse will have available to them. So you can observe their nostrils. Like if they're always slightly flared, then that can be an indicator. Obviously, if there's, you can look at the speed of them or if they've got any mucus or anything in there too. But so you can look at the nostrils, how they breathe in, how they breathe out, how big they go, how big they stay, how big some horses will just be holding them open a bit. That's not normal. So there's a reason that they're like trying to get more air in. You can look at the flank, like so if you said earlier, and watch that kind of moving. But if a horse is quite shallow, it's very difficult to look at the flank. And the same with the nose. If a horse is sniffing, it's difficult to look at the nose. And if you put a stethoscope on, you don't hear anything in the horse. Like with us, you can hear some like noises with inspiration, expiration, but with them, it's very quiet. Um, you can watch the abdominals, like maybe you'll be able to see it in the belly, except if the horse is having an obvious motion in the belly, there's usually a problem as well because the belly muscles become more pronounced in breathing when there's more effort involved. And so it shouldn't be that obvious that the belly is moving, especially if the belly is moving and the ribs aren't like doing as much motion. They're trying to use those abdominal muscles more than they should. And then you can take it to the rest of the body. So, can you see the breathing in the rib cage? Can you see the breathing in the top part of the rib shelf? Can you see the breathing in the spine? Can you see it going back to the pelvis? Can you see it in the sacrum? Can you see it in the shoulder, in the scapulars, in the wither, in the neck? Like, how far can you see it within your horse, and how far can you feel it? You know, if you put your hands on your horse, and we use this, like osteopaths and biodynamic use it as a treatment and a diagnosis, you know, like if I put my hand on an area and there is nothing happening there, there is no breath, you know, then there's quite a restriction in the flow of energy through that horse. If I put my hand on the sacrum and it has a really nice motion with the body, like you've got a good flow, and it's a way that we treat, it's a way that we assess. It's a really useful tool, and it's something that you can super easily use. And I'm just going to give one example of a horse that I've worked with where I was actually doing some postural work with her. And what I noticed was every time we brought her into the stables for her sessions, she was always breathing more than she should. She was breathing like she was unfit. And we hadn't even done anything yet. Like, we just brought her into the stables. And at the start, I think it was summer, and she was a black horse. So we're like, you know, maybe she's struggling a bit for some reason. And then I'd do some postural work with her, which was quite simple, and her nostrils would be bigger, and she'd be like, there was an obvious breathing, and I think there was a slight noise from memory. And so, you know, after a while, I said to the owner, I just think you should investigate why she breathes this way. Like, if we don't find anything, that's great. Like, then whatever. But just let's get her scoped and see. Anyway, she had laryngeal paralysis, like a mild laryngeal paralysis. So then we focused more on her hyoid and her TMJ, and the owner was doing I showed her how to do some regular hyoid releases for her, and the breathing has gone away after we started doing that. So she didn't have any surgery. She now works harder than she did back then. But yeah, just working on her neck function, hyoid function, focus on the laryngeal nerve. We were actually able to alleviate that. I'd love to get her rescoped to see if it's changed from a scoping perspective, but it's definitely changed from a clinical sign perspective. You had an example as well.
I did. It's yeah, it was quite an interesting one because I had gone to see a horse who in a tropical climate, and they said she breathes so hard. We've had to stop working her. She doesn't really want to walk around or do anything. We just are putting her in front of a misting fan basically through the hottest part of the year. And they'd had her larynx scoped, and they'd tried antibiotics with the thought that maybe there's an infection that we can't find or something, and there'd been no resolution. So I'd come to see her after one full season where she'd had a hard time, and they actually had said she has such a terrible season. We did consider euthanizing her. Like, I don't know if this is going to fix. It was really like, oh, it might just be nice to have you look over her anyway, and I'd ask some questions. But basically, and I didn't know the first time that I saw her, like, taped her diaphragm. I thought lots of interesting things were going on, but she was sensitive to a sinus tap on her face, and I had put a stethoscope on her trachea, like on her down the underside of her neck, and I could hear like a rattling sound going in and out. So, and I thought, oh, maybe it was an infection. You know, it was strange. She also had one weepy eye that was a little bit funny on one side. And when I felt the air coming out of her nostrils, it wasn't on one side. And I thought, well, I'll block the other one. And she got very stressed about it. And so obviously she wasn't breathing out of one nostril. And she made quick use of essential oils and some lymphatic work through her face and also some tape. And the issue went away for quite a good amount of time. And so I ended up seeing her again and we spoke. She'd actually had another scope, still no issue, no infection or anything like that. And now the owner just manages it by putting tape on and using Vicks Vapor Rub, eucalyptus oil, and a doTERRA sinus blend. And they just they just treat her as need be. They check her nose every day to make sure that she's breathing out of both of them and work as it goes. So
Yeah,
it's just an
sinus problems can be difficult too, because if they just do a normal scope where they go, um, like
the left,
depending which nostril they go through, yeah, like they might
it's
not
nearly
actually
always the left.
visualize the sinuses.
Yeah.
And some of the sinuses are not easy to visualize. Like you can't visualize them. Generally, they'll do an X-ray to have a look at that. So, yeah, and they can get all sorts of stuff in their sinuses.
Yeah. So it's important to have your nasal passages working for your respiratory system as well, because if you've only got one little tube to breathe in and out of, you've got to work pretty hard.
Yeah, which brings us to like, how can you observe, what exercise can you do with your horse? One of the things is just that observation, which could be, like you said, Sophie, observing, is the airflow the same out of both nostrils?
Yeah. Yeah.
In and out. And then observing like what we talked about before, the rib cage and the rest of the body. But you can do a little exercises where after you've made your observation, so make your observation of where you can see and feel the breath. Make sure that you're relaxed in your body. And then you can take 3 deep breaths. So just like in through your nose and out through your mouth. So you're just relaxing yourself. So you do that 3 times. And then with your breathe in, so breathe in, and as you breathe in, think about the breath expanding through your pelvis. And this is an exercise that I've done. Robin Larson Sheldon talks about it. Mel also talks about it when you're working with the horses on the ground and riding, Mel Fleming. But like as you breathe in, like feeling the expansion through your rib cage, through your belly, and through your pelvis. And just bringing your awareness, and then as you breathe out, like, everything kind of softly comes in, and then breathe in, expanding as much as you can. And then as you're doing this, so you want to take at least like about 6 seconds on the in and 6 seconds on the out, just through your nose. And as you're doing this, observe the horse. So you want to do it, for at least a few minutes. I would say like 10 minutes, but if you don't have much patience, then set your alarm for 3 minutes to begin with. And just, yeah, see what happens and just have a soft focus. There's no expectation. Where can does your horse's breathing change? Yeah, does it expand more? What do you feel? And it's a really nice connection exercise to yourself and to your horse, but it's also a really good way to bring awareness to their breath as well. And often, when you're standing with somebody and you like take a deep breath and then they take a deep breath, or you're with your horse and you take a deep breath and they go, oh, okay, everything's fine here. So yeah, doing that just on the ground, you might have a monohalter lead, or you might just be standing with them in an area. And then doing it when you first hop on, so often we get on and then we're doing something straight away. But when you first hop on, just observe, where am I breathing? Am I breathing in just into my chest? Am I fully breathing into my body? Can I like relax my pelvis, open my hips? Can I feel my horse breathing underneath me at all? Sometimes there's nothing. Does it feel tense or relaxed, or, like observe? Can I feel the rib cage expand under my legs? And then tune into the breathing of like breathing in and through your nose for the 6 seconds, expanding your pelvis and out. And as you breathe in, think about like your whole body kind of allowing the horse to expand as well. And then you softly come back into contact. And you want to do this with the least brace and the least tension possible. So you might just be walking around on a loose rein, just connecting in with your breathing and connecting in with the horse's breathing. And initially, you might not feel anything, but this will improve your feel and connection with the horse's back. And I've done it with Jelly and, really focused on breathing into my pelvis. How soft can I be? How much connection can I have through my spine? And man, it's like the best rides I've had on him. Like all of a sudden, and especially as you start moving and trotting, there's been some moments where I just feel his whole body lift up underneath me and it's carrying me and he's breathing. And he might have had like a deep breath or he might have done a snort and it's quite a it's quite a beautiful feeling. Obviously the saddle needs to be comfortable, girth needs to be comfortable. Like the more everything is comfortable, the more you're going to have feel in that. But the power of connecting to your horse's breath on the ground, ridden, in your observations, when they're standing around, anytime you think of it, it's very therapeutic, and also gives you a lot of information.
Definitely. So I think as a takeaway, breathing is pretty important.
Yeah, a
Pretty
little.
foundational. For lots of different fronts, like you said, relaxation, true parasympathetic state, which is when your healing happens, but also because um, it's important for expression throughout the body. The body is made of cells that are full of liquid, and as there's a shift through the body every time there's a breath in and a breath out, and so you're seeing that coherence and the ripple throughout the fascia and the tissue and every cell that's able to expand slightly and then move with the breath. So, when there's brace in the body, you don't have that. All of those little fascial compartments can't move in this beautiful
You,
opening. Yeah, it's beautiful. It is beautiful when you see it. So it's a primary foundational thing for the horse, the breathing, and it should be a priority. Like it's not a nice to have or anything like that. It's a priority that to have healthy breathing.
yeah, yes, a breathing horse, if they're breathing through their entire body, they cannot not be relaxed. Like it's the most connection that you will acquire with the horse, and it's going to provide all of their muscles with the necessary energy. Um, and yeah, like generally they're going to feel safe in that space because they're not going to have the brace. So yeah, get observing your breathing. We do it in level 2 of our functional posture course. It's one of the exercises that people do, and it's always creates quite a change in people when they've come back and done that exercise, or an awareness, brings a really different level of awareness. So, and observe your own breath right now. So, thank you for joining myself, Dr. Raquel Butler and Sophie Vanderberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes. Look out for our next Equine Functional Posture online course. We'd love you to join us. And give us a 5-star rating so we can share more valuable insights. And we would also love any listener requests for topics that you would like to be covered. Just send us an email.
We'll see you in the next exciting episode.